Hey, what's up? I have an incredibly powerful conversation to share with you today. I get to sit down with Dr. George Rust, a public health warrior who has literally done it all, from treating migrant farm workers in rural Florida, to leading programs at Morehouse School of Medicine, to fighting on the front lines during COVID-19. Now, in this episode, we get into some of the really important topics. Dr. Rust opens up about his journey working at the intersection of health, race, and poverty. And trust me, the stories that he shares will stick with you. In this episode, we have a really great conversation. Dr. Rust opens up about his journey working at the intersection of health, race, and poverty. And trust me, the stories he shares will stick with you. We talk about what it means to truly earn trust in communities that aren't your own, the critical importance of respect in healthcare settings, and the concept of needless suffering that he's witnessed throughout his 4-decade career. We also get into his brand new book, Healing in a Changing America, which couldn't be more timely. Dr. Rust shares candid insights about navigating public health in Florida during some of the most politically charged moments we've seen, and what it means to stand firm when ideology threatens to override evidence and expertise. You know, what I love most about the conversation that I had with Dr. Rust is that we didn't just talk about the problems. Dr. Rust discusses perseverance, coalition building, and a beautiful vision for health equity that he truly believes we can achieve. He shares lessons from legends like Dr. David Satcher and Dr. Lewis Sullivan, offering real wisdom for anyone seeking to make a difference in public health. Now, whether you're in healthcare, you're a healthcare professional, public health professional, a student, or someone that just cares deeply about their community, about justice, and about equity, this conversation has something for you. So grab your headphones, make sure you pay attention if you're driving, but settle in and let's get into it. Hello, everybody. Welcome back to the Healthy Project podcast. I'm your host, Corey Dion Lewis. And today I'm here with a guest that has done everything in public health that you can think of, has been through a lot. We're going to get into some of that today. I have Dr. George Rust here with me. George, thank you so much for being on the podcast. I really appreciate it.
Well, thanks so much for having me here.
Yeah. So, let's just get right into it, because I want people to know about your story. I see your book in the background, so we'll definitely get into the book. But what first drew you to work at the intersection of health, race, and poverty?
I got drawn into it at first because of just wanting to make a difference in the world, wanting to help people who needed it most. And that was pretty vague at the time. And then the more you do it, the more you get drawn into the specifics, and you're caring for people who sometimes are suffering in ways that they really shouldn't have had to. And you begin to see some of the structural inequities behind all of that. And you see that race and poverty are driving some of the health suffering that you're seeing.
Right. What changed in your thinking after that experience, after experiencing something like that in your work?
Well, it took me a little while. I went to medical school at Loyola. It was a suburban medical school, and even did my internship there. It was training me to be a subspecialist to care for well-insured people. I think they've grown a bit since then, but I transferred over to Cook County Hospital, an urban public hospital in the middle of Chicago, and got into the real world blood and pus, nitty gritty of the realities that people were experiencing. And I had the opportunity to do it with teachers and leaders who had committed their whole lives to that. Dr. Jorge Prieto was my chair of family medicine. He had grown up in Mexico and had to move from house to house because his family was under death threats because his father was fighting for democracy in Mexico. They ultimately moved to this country, and he worked with Cesar Chavez in the farmworker movement. And then he moved to Chicago and became a real voice for Latino health in Chicago and opened clinics. One of them is named after him now. and he recruited other faculty that had similar kind of passion and commitment. So I really found my people there, and we found a common sense of mission in what we were doing to try and help people's lives be just a little bit better because we could walk with them in their journey.
Right. And there's something to what you said there, George, about walking with somebody in their journey. And I'm curious from your point of view, you're walking with somebody within their journey, but you're not from that culture and you're learning from people who have that cultural experience. Can you tell me what it was like to, one, have the mindset to want to learn and walk with somebody, but what is that experience like in going through that and just trying to like, hey, I know I'm not from here. I don't know the culture, but I want to learn more so I can help improve the health of these people.
Right. For me, it was just this wonderful learning opportunity. It was embracing all of the ways that people could be different and that I could learn from them. And so I never saw it as a challenge so much as just this wonderful growth opportunity. At the same time, you have to be really humble about that. 40 years in, and my Spanish is still not pretty to listen to. Uh, and when you think about deeper issues like trust, if I were to tell Mrs. Sanchez that she ought to take another pill for her diabetes because it wasn't under good control, she would nod and smile, which meant that she was listening to me and she respected me. It didn't mean she was going to take the pill. She
Mm,
walked out to the front desk, and one of our front desk workers, Carolina, might be the one that she asked. Said, hey, he wants me to take another pill for my diabetes. I don't like to take medicines. What do you think I should do? If I was being a good boy, if I was on a good day, Carolina might help me by saying, you know what? He's a good doctor. Maybe you should try the blue pill.
mm,
If it was our nurse practitioner, Ann Gray, who everybody loved, they would say, she's a good person. Maybe you should give it a try. So I didn't come into the community with trust, and I had to learn that. I often assumed that I came in with trust, and then I, tried not to blow it. But you don't come into communities carrying that trust with you. You have to earn it. And much of the time, I was trust adjacent. If Carolina trusted me, then Carolina could get my patients to trust me.
right.
And it's that way, I think, with a lot of cultural learning. We have cultural bridge people we think of that can pull me aside after a patient visit and say, you kind of missed what was going on there, or let me help you, Sparky. There's some things, there's some dynamics here that you may not be aware of. There were
Right.
I went from urban Chicago, Cook County Hospital, super busy, um, to super busy migrant clinic in Groveland, Florida, two stoplights, no Dairy Queen, rural community in the Farmworker Health Association. Um, and the poverty was very similar. There were trust issues that were very similar, both in the Latino community, but also in the African American community. The roads weren't paved on the black side of town. There was an awful racial history in Groveland that is now known as the Groveland Four. Um, and there were some other episodes as well. But it's almost like America's a dysfunctional family. Nobody talks about their shame,
Mm,
and everybody walks
that's
around
real.
on eggshells. And so, if you're new to a community, you really have to go in understanding that there's probably some deeper stuff here that I'm not going to hear about for a little while. And I have to really be open and ask naive questions and see if I can better understand what people's real world experience is.
Right. Did you find it um kind of as a relief to the patients when you would ask those questions? Because I've seen that too in my experience where, I mean, you don't know what you don't know.
Right,
People may ask me questions about my culture and be kind of like nervous about asking me. And I'm like, don't be nervous because you don't know. I respect you for even
right.
asking me the question. But did you find it? like it was kind of a relief to the individual you were serving that you were asking questions and trying to understand them better.
I think so. Uh, I, One of the things that I learned at Morehouse School of Medicine, I spent 25 years there, was how to have much more open conversations about these intersections of race and culture and health and poverty, and to speak openly about those things. I think for patients, they sense what the spirit is that the questions are coming from. Right? If
Mm,
you're questioning in a judgy kind of way, not so welcome. Right? But if you're really open and willing to learn, um, one of the ways that I would learn when I was in Groveland, and I was admitting all my own patients to the hospital, I was on call 24/7 for a year. So I often say those 6 years were the best 40 years of my life. But one of the things I tried to do for a little while, it was hard to sustain, but when I would discharge a patient from the hospital, I would try and do a home visit within a week. And so you walk down that dirt road and you enter a house and you're welcomed by a family, but you see the realities of what is possible. You see the strengths and the resiliency, but you also see some challenges. Um, it made me much better at not giving stupid advice to people that just really wasn't within their reality to be able to do what I was suggesting.
mm.
And so that some of my learning wasn't so much from asking questions, but it was just being willing to immerse myself in the experience.
No, that's real. I love the title of your book, Healing a Changing America, in a Changing America. Can you tell us what inspired you to write this book now, as we are seeing a lot of changes in America?
Yes. Well, and unfortunately, I think some folks are really struggling with that change, and particularly people who may picture America as this, white Christian, everybody looks like me and everybody thinks like me kind of place. And it hasn't been that for a long time, but people have been able to stay in their bubbles. I tell a story in the book about, a lot of our patients in the emergency room at Cook County Hospital looked like they were from the neighborhoods that often use that hospital. But every now and then you'd get somebody in a banker's suit and shiny shoes and, all nice haircut. And, he'd come in drunk, crashed his car.
Mm,
They'd wheel him in. And somewhere in the process, he would look up and look around and hear the chaos and smell the smells. And he'd say, "Where the hell am I?" And for me, I think some folks, particularly in white America, are waking up and saying, "Where the hell am I? This doesn't feel like the America that I imagined." Toto, we're not in Kansas anymore.
right,
And in Florida, for example, we've had this reactionary sort of stop woke legislation and the don't say gay bill. In part, I think because people woke up and realized that their elementary schools were majority minority children now. Um, and some folks embrace that and say, this is what America was always meant to be.
right.
And
Yep.
some folks just freak out and want to pull us backwards and want to, go back to some 1950s understanding of what they thought America was.
Yeah, and I feel like there's always going to be that fight. I feel like that fight doesn't go anywhere. Um, but in the book, I want to go to the book because you said something. Is there? Can you share a story from the book that you feel like illustrates today's clinical reality?
Well, the book is subtitled "Doctoring in a Nation of Needless Suffering," and I
Hmm.
would have to say that has been one thing that throughout my career has troubled me. Right, you see a 35-year-old man who's had a stroke because he didn't get his blood pressure treated, didn't know where to go, didn't think he could afford the medicine. And now he's paralyzed on one side of his body and can't throw a football with his kid because he didn't get just simple treatment for high blood pressure. I've seen leg amputations in diabetics. I've seen all the complications of diseases that are much more advanced than they should have been. Um, I had a woman almost bleed out in front of me from a cervical cancer for lack of a pap smear. And so that unfortunately has been a continuing theme and continues to this day. One of my colleagues here at FSU, who has a strong relations in the farm worker community up here near Tallahassee, was trying to get help for a young boy who was working on a farm and got his hand caught in some farm machinery, tore up his fingers, tore one of the tendons on his fingers. Um, Went to the emergency room and they bandaged it up and cleaned it up. But that tendon, if it wasn't sewn back together, was never his finger was never going to work again if they didn't
Mm.
do that. He needed a hand surgeon. The local hand surgeon said you got to bring $500 with you for the first visit for us even to see you. And so Dr. LaJoy ends up making phone calls for 3 or 4 hours trying to find somebody who will take care of this person. And we found one of our alumni from our College of Medicine who was a hand surgeon and finally agreed to
Oh,
take care
wow.
of the young person. Um, it's what Fitzhugh-Mullen once called tin cup medicine. Please, sir, may I have some health care? And the people who are on the front lines in community health centers or in urban public hospital emergency rooms, they kind of spend all day doing some of that, trying to get a specialist who will see their uninsured patient. And they're really standing in the gap. Sometimes just we ended up doing things that were way beyond our training sometimes because nobody else was going to do it. I had a patient one time say, Doc, if he had a broken arm, he said, Doc, if you don't put a cast on it, I'm going to tie a stick on it. And I thought, well, in that context, I'm a pretty good cast putter on her. But, it's not my preferred option.
Right, but it's a little better than a stick.
Better than a stick. That could become my new theme.
Yeah.
Better than a stick.
Better than a stick. This kind of leads into kind of the next topic I want to discuss with you. And talking more about health justice. And I know you've had some talk about Dr. Lewis Sullivan and Dr. David Satcher, as mentors and teachers of yours. What have you learned from them about health justice?
When I went to Morehouse School of Medicine after I'd been in the farm worker clinics for 6 years, I went and wanted to teach and wanted to write. And Morehouse School of Medicine was a young institution at the time. It had been born out of Morehouse College, but when I got there, it was one building on a gravel parking lot. Dr. Lewis Sullivan was president of the institution. He was the founding president. And basically, people had told him, you can't start a medical school, it won't work. And he's just kind of stubborn enough to say, gonna do it anyway, and did it. Um, and he had that sort of mindset. I think I'd learned some of that from him. He and Dr. Satcher double teamed Congress to get the National Center for Minority Health and Health Disparities established at NIH. Now it's the National Institute for Minority Health and Health Disparities. Well, they worked that through Congress, even though the director of the NIH at the time said, over my dead body. And they said, as you will. They went ahead and got it done. So Dr. Sullivan was that kind of, just persistent, do the right thing and don't back down, but in a very proper, formal, polite kind of way. Dr. Satcher is just next level hero to me. I used to joke about wearing a "What would David Satcher do" bracelet on my wrist. Um, I worked with him for 2 years every day before I learned the stories of him being a student leader in the civil rights movement when he was at Morehouse College, having grown up in Anniston, Alabama. Um, he went on a hunger strike with Martin Luther King's brother. He went to jail with Martin Luther King's brother, and they did a hunger strike in jail with Martin Luther King's brother. If I did that, I'd be bragging about that the first time you met me. For him, 2 years in, and it just slipped out one day. But a brilliant man, soft spoken but firm and consistent, believing in health equity, holding to his moral values, and able to speak to folks in a way that they could hear it. Follow the science, let the evidence show, let's do the right thing. And so his combination of intellect and integrity and passion for health justice was just a constant inspiration to me there.
Man.
And larger Morehouse School of Medicine just had tons of people, not the famous people, but from the front desk secretary to the president of the institution, there was a sense of mission. And health justice was at the core of it. And so we did have very nuanced conversations, complicated conversations about race and health and poverty and ethnicity and culture and caste. And I just learned a ton. It was just an incredible experience. And they showed me incredible grace and generosity. When I came there as a kind of a smart alecky white guy, thought he knew everything. And they trusted me with running some programs and raising some funds to build some programs, and let me lead development of the National Center for Primary Care. And that's when Dr. Satcher came back to the institution to lead that center, and I became his deputy. Um, they were incredibly gracious before I had earned it. Also learned, I guess, at Morehouse just how important this theme of respect is.
Mm.
I think white folks just kind of don't get that. I didn't get it. I would say, yeah, respect. Okay. No. um, White folks want to go for that shallow intimacy right away, right? Like, call me George. We'll be
Oh,
buddy, right? And
right.
and so culturally, it's just different to say, no, wait, demonstrate respect first. We may get there at one point, but I know people at FAMU or at Morehouse that have known each other 20 years, and they will call each other by first name when they're behind the scenes one on one. They walk in a public meeting, and it's Dr. Harris and Mr. West, and they show respect in those settings. Um, and that isn't always the case in white normed institutions.
Right. And there's something to that. And you would think that um it seems so simple, like, hey, show respect at a different level than just surface, but
Yes.
it can be hard for some people to understand what that means.
Mm-hmm.
For somebody that wants to, and I think, and I want to put words in your mouth, but I can only assume that some of those learnings of how to show respect to those that you respected, that carried over to the work you did in other aspects of your life. So, like, what can somebody that is a young clinician that wants to do half of the things that you've been able to do in your life, where should they start?
Well, respect is not a bad place to start.
Mm,
Residents and physicians in training learn very quickly that in the hospital wards, the doctor is called doctor, but the nurses are called by their first name, or nurses' aides are called by their first name. When I started calling um, our nurses in the clinic Ms. Cobb instead of Barbara, that's just the beginning of trying to demonstrate that you get it a little bit. Um, we routinely have that conversation here at FSU, and we'll have meetings with our colleagues at FAMU. And I will try to say to my colleagues here, please just hear me on this, just trust me. And folks walk in a meeting and go, Bill, how are you? And it's like, did we not have this conversation and you swore you would get it right? Um, I'll give you an example of that. With Dr. Lou Sullivan, who is a fairly formal guy. I think nobody at Morehouse School of Medicine called him anything other than Dr. Sullivan, except for his older brother who worked there. But everybody just called him Dr. Sullivan. Well, we all, senior leaders at the institution, went over to a meeting at a local hospital that was trying to develop an affiliation with us. And they had laid out name tags before we ever got there, with our names on them. And, Dr. Sullivan had a name tag that said Lou, and I had a name tag that said George, and everybody around the room. Now, none of the CEO of that hospital thought that they were democratizing and knocking down the hierarchy by everybody calling each other by first names, even the CEO, not understanding that in a minority setting that you do the opposite, right? You would elevate everybody rather than
Mm,
bringing the names down. You'd show respect first. Um, so we had a meeting. Everybody had their mask up. None of the white folks from that hospital realized what the dynamics were. When folks saw Dr. Sullivan pick up his name tag and put it on his chest and says Lou, everybody cringed inside, but the masks were up. Nobody showed it. And that affiliation agreement never came together, at least not for the next couple of years. Um, and nobody in the room on the hospital side knew what had happened or why that was. Now, coming
mm,
out of that meeting, one of my colleagues turned to me and just spontaneously started telling a story of how when was a child with asthma, his mother had rushed him to Georgia Baptist Hospital and taken him in the main entrance. And their doctor saw them coming and quickly rushed them out of the entrance and took them around to the colored entrance to make sure that they didn't, quote, get in trouble. He was trying to protect them, but obviously that was a very demeaning experience for the child and the family. And this physician who, um, I asked myself later, why did he suddenly tell me that story after this meeting? And what came through to me was how triggered he had been
mm.
by the disrespect that he had felt in that meeting. So I don't get it right a lot of times, but I'm learning and I'm trying.
Right, right. Man, and I think that probably set the tone for the whole meeting, and it was done from the jump.
Yeah, and it was just naive. I don't know any better, so you know.
Right.
But it's a form of what I call white norming, right? You assume, like I grew up white, obviously. I grew up in a pretty privileged kind of environment. Boca Raton, Florida is a rich people's town. We weren't rich, but we that's where we were. I went to an elite college prep school, um, which my parents couldn't really afford, so I worked as a janitor there to be able to keep going there. Um, so I saw privilege kind of from both sides. But when it came to race, white folks never talked about themselves as white folks, but fairly young, they would acknowledge that there were other people who were other. And so you would learn about categories that were not white, but white folks were just quote normal. White was just to be a regular person. And you still hear that today with people saying, well, I don't see black or white, I don't see race, I just treat people as individuals. Well, it's usually white folks who are saying that, right?
Mm,
Because
hmm.
what what they don't realize is they're gaslighting the racialized experience that many people do have in this country, um, and the prejudice and the discrimination that people do experience. As soon as you say, well, race doesn't matter, and why can't we all just get over it? Um, that's really gaslighting people's experience and
Yeah,
diminishing.
and there have been times where I've had to have that conversation, and it's like, I know you are trying to mean well,
Right. That's exactly right.
but it's doing the opposite. And
That's
this
right.
is why.
That's one of those come here, Sparky moments, right?
Yeah.
Come here, Sparky. Let me tell you why that was not such a helpful thing to say.
Yeah. Dr. Russ, and going back to your book, Healing in a Changing America. And like I said earlier, the book and that title right now in our country is very, is very interesting. And I would love to learn more about, or hear more about your experience. You're in Florida, you're in public health, you were
Yes.
there 2020, COVID-19,
Hmm.
and trying to save people, while if maybe it felt like in the time you were fighting against the other powers that be.
Right.
So walk me through that experience,
Sure.
as
It's a
someone trying
weird
to
time
save.
to be doing public health.
Yeah.
Is all I can say. And to be doing it in Florida makes it double weird. Um, the Interestingly, when COVID first hit, we weren't as polarized. Um, President Trump led Operation Warp Speed, developed a vaccine really faster than any of the experts thought it could be done. Our governor was very helpful in putting teams into nursing homes to get more people vaccinated. I was in lines we did 1,000 vaccines a day in a drive-through vaccination program. And so we had a lot of support, and public health was right on the front lines of doing all that. And then at some point, it polarized, and this I think because public health, maybe we weren't humble enough about the impact of trying to make everybody wear a mask. There's history for that. Back in the Spanish flu, there was an anti-mask league in San Francisco. I didn't know that, but in
Hmm.
1918, there was actually an anti-mask league. In Montreal, in the 1880s, there were riots because they were trying to force people to get inoculated against smallpox. So I guess that comforts me a little bit that we've been through this before, and
Right.
maybe we'll come back to normal at some point. But we did move into a zone where an ideology began to dominate over competence and over facts. And I call it a me all versus we all. The notion that individual autonomy trumps everything and individual rights, and I'm free to do whatever the heck I want. And if I don't want to get a vaccine, you can't make me, as opposed to balancing that with community responsibility. That's always been a tension in public health. But we're seeing it now in our state with a notion that we should get rid of all mRNA vaccines, that parents should be able to decide freely whether or not to send their kid to school unvaccinated. Well, from my perspective, if you send your child to school unvaccinated and there's a measles case, we are going to send your child home for 21 days because they almost for sure are going to get measles and they're going to spread and make an outbreak happen. So I went through this just recently. We had a measles case here in Tallahassee. The good news is public health worked. We got notification that a person had been exposed on an airplane flight. Our team made contact and earned trust and worked with the family. And symptoms developed. I went to the house and examined the patient and took samples and proved that it was measles. But there was another young adult in that house that was not vaccinated and clearly had been exposed. So there's a 90% chance that they're going to get measles. Now, that person had a public facing job. If
Mm.
they had gone to work and then developed measles, we would have had an outbreak here in Tallahassee, not unlike what we saw in Texas. Uh, we, that me all versus we all kind of started to kick in at leadership levels that, well, we can't really use the word quarantine and we can't make him not go to work. And we ended up having to work behind the scenes, and I wrote a letter for him so he would be excused from work. But we shouldn't be having to push pull with our own leadership
Right.
just to do what every public health person in America knows is the right thing to do. And I found myself saying, would you rather deal with having somebody not go to work for a couple of weeks, or would you rather be explaining to the public why you let a measles outbreak happen in Tallahassee? Um, we had that option, and so you wouldn't let a cardiologist do brain surgery, but somehow in public health, any old doctor will do as long as they have the
Mm,
right political ideology. And in fact, at CDC now, we don't even have a doctor. We have somebody who came from a political background, no clinical background. Our HHS secretary, similarly. I'd like to just go back to basic. Let's make sure they have real credentials. Let's make a job description
right.
that says you got to have some experience in public health, and you got to have some training, and you got to know what you're doing. Maybe progressive leadership experience in that space would be useful.
Yeah, it'd be
Call me
it'd be
crazy,
nice.
but
I know it's a shot in the dark, but let's see what we can do here. Um, is there, is there something we can learn from your experience though? Like understanding, given the challenges you went through and still being able to succeed and seeing public health work. Is
right.
there something as public health professionals, clinicians, those that want to see the betterment in the population health improve? Is there something we can learn?
I think so. In fact, I wrote this book in some ways as a sort of a manual for my younger self. If I had only known some of the mistakes I would
Mm,
make and some of the skills that I had to learn and some of the knowledge that I gained. So I tried to write it with that in mind. Um, I I think part of it is perseverance. I was doing farm worker health during the Reagan administration, and we used to say the tide comes in and the tide goes out. We got to hang in there, and then at some point we'll be able to go forward in our work. But in the meantime, we're standing in the gap. There are people who will suffer more if we're not there. And so, to the extent that we can be there with people, heal them when we can, and when we can't, hold their hands and walk with them on their journey, knowing that they're not alone. I do think that public health is still something that can make a dramatic difference at scale, right? It's not just one patient at a time, but we could save thousands of lives. When we did the Georgia Minority Health Report, we found that just by eliminating the black white gap in premature deaths, you would save 43,000 person years of life every year in the Black community in Atlanta, in Fulton and DeKalb counties. 43,000 grandmother years, 43,000, wisdom years
wow.
lost from that community every year just due to the gap between black and white premature death rates. It's the reason Dr. Satcher and I and some others wrote the article, What If We Were Equal? Showing that we could save 83,000 lives a year if we could eliminate the black white gap. So part of my work now has been to try to put that out there, um, that we can achieve this. There are communities with less disparities. There are a few communities that, in a few specific instances, don't have disparities at all. What can we learn from them? How can we hold ourselves accountable to knowing that that's where we have to get to? Let's assume that we're going to get to equal and equitable outcomes for all. Um, and then we can work our way back to how do we get there. But let's hold ourselves accountable to getting there and getting there more quickly. Um, I sometimes quote Desmond Tutu, uh, at a time when he had no earthly reason to be optimistic. Right? When apartheid was just in its awfulness, and friends and colleagues were being killed, he would use the phrase, "We have already won. They have done their worst to us, and we have already won." And you'd have to say, well, where do you get that? But
Wow.
he was painting a vision of a future that would be realized. Didn't know exactly when, but whether it's Martin Luther King and the I Have a Dream speech, whether it's Desmond Tutu, Nelson Mandela said, it seems impossible until it's done. And if we can just kind of apply that to health equity as well, that we will get to equality of outcomes, we will get to structural equity, but golly, we keep dragging our feet. And in
Mm,
the same way, I feel like our country is in this birthing process of trying to become this multicultural, pluralistic democracy for all that would just be such a wonderful rainbow coalition if we could just get through this hard labor birthing process that some people just want to keep prolonging, right?
right.
If we get through that and get to the wonderfulness on the other side, we'd be fine. But that we're not quite there yet.
Yeah, but as a optimist myself, I think we can get there and we will get there. But as everything, it will take time for sure.
It'll take time and it'll take people working hard at it. One of the things I've had to learn in my career path is you ain't going to do this alone. Right?
Mm,
Wanted to be the doctor for the poor and say change the community. I had to learn pretty quick. You got to do that with a team. You got to build a coalition. You got to work in partnership with community and with others who are like-minded, or you're just going to burn out, frizzle.
yeah,
But if you're able to find like-minded folks, work together, form coalitions, and support each other. Self-care was another important lesson I had to learn in all of this. Be compassionate with yourself. I'll peel back a layer of the onion and find some new racist thought or some, bigoted something down in there that I thought was yesterday's cheeseburger. I thought I'd gotten rid of that, and you have to have enough self compassion to look at it honestly, address it, because that's what's going to let you then go to the next layer of the onion and dig a
mm,
little bit deeper and continue to grow. You are where you are. Be open to growth and change and be compassionate in that process and care for yourself in that process so that you're healthy enough to be able to be open to further growth going forward.
that's awesome. Well, Dr. George Rust, author of Healing and a Changing America, when should we be expecting the book? When is it coming out?
Actually, it's out now. They
Oh,
had a
okay.
November date, and
Yeah,
Amazon is shipping it now. I think the Kindle edition you can't download until November, but you can get it directly from Johns Hopkins Press, or you can. It is up on Amazon now, and I've had friends who've ordered it and received it already. So
yeah. Well, I make sure
yeah,
I'll have those links in the description of this episode and the newsletter and everything else, so people will be able to
well,
reach out and grab this book. It's a great book. Dr. George Rust, thank you so much for your time today. If there's anybody listening or watching that wants to connect with you, learn more about what you're doing, where can they reach out?
at FSU would probably be the easiest way. The easiest email address would be grust, GRUST, at fsu.edu. Um,
Perfect. Perfect. Well, again, Dr. Rust, thank you so much for being here. I really appreciate it. And everybody, thank you for listening to the Healthy Project podcast. I'll highlight you next time. All right, there you have it. There was the conversation I had with Dr. George Rust. I hope you took away as much from that as I did. If you want to go deeper into Dr. Rust's work, make sure you check out his book, Healing in a Changing America. It's available now on Amazon and through Johns Hopkins Press. I've got the links in the description below. Now, before you go, I have some exciting news. We just launched the Healthy Project Plus. It's our brand new premium newsletter. For just $5 a month or $50 for the entire year, you'll get exclusive behind-the-scenes access with guests and myself, early access to episodes, discounts on merch, and so much more content that we just can't fit into the episodes. Now, even if you're not ready for the Healthy Project Plus just yet, head over to healthyproject.co and subscribe to our free newsletter. You'll stay up to date on new episodes, you'll get health equity resources, and join a community of people who are serious about making change happen. All right, now if this conversation resonated with you, do me a favor, hit that like button, share this episode with someone who needs to hear it, and drop a comment and let me know your biggest takeaway. I do read every single one of these comments. So thank you so much for being a part of the Healthy Project community. Together, we are building something very special. So until next time, stay healthy, stay informed, and keep fighting the good fight. I'm Corey Dion Lewis. I'll holler at you next time.